Sebastian coming on, Sebastian Alcantara coming on with Oscar here. And so buckle up. We're glad to have you here, Sebastian, and glad to get to hear about Oscar and their plans for this this upcoming open enrollment here. So with that, Sebastian, if you can unmute yourself, and I'll stop sharing my screen and let you take over here. But happy to have you guys, and we'll get going to the next section here.
Awesome. Well, my name's Sebastian Alcantara. Thank you so much for having me today. I'm stepping in for my colleague, Jared, who is sort of the one that manages our Mid-Atlantic national partnerships. I manage our Central and West growth. A little bit about me. I'm based out of Phoenix, Arizona, which is actually nearby our Tempe, Arizona office where we have our operations. 2 weeks ago, I actually celebrated my 6th year anniversary with Oscar Health. So at this point, I feel like I'm a lifer. They've got me to stick around for quite some time. And as you'll see over the course of the last 6 years, we've grown quite so much. So a little bit of an introduction about our sales team nationally. There's 6 of us. We're scattered across the country these days, especially being remote, hybrid, little combination of everything. But yeah, these are the folks, my wonderful colleagues and the folks that you at some point might be interacting with here at Oscar Health. So let's go ahead and jump right in. Here at Oscar, we combine technology with our member-centric approach to drive more cost savings and hopefully provide higher satisfaction to our members, your clients. Couple of milestones here. So as I mentioned earlier, I celebrated recently my 6th year anniversary with Oscar. When I started, we had less than 100,000 members. If you fast forward to today, we are over 1 million members nationwide. Now, there's 2 milestones that I want to talk about that aren't on this page, but I think they're very important to bring up. The first one, back in April, we announced that we were taking on a new CEO by the name of Mark Bertolini. If you haven't heard the name before, or maybe it does ring a bell, Mark used to be the CEO over at Aetna prior to the Aetna-CVS merger. So very excited to bring someone on board with a ton of industry experience and getting us back in growth mode. The second piece of news here is we had an earnings call last month, and we announced that for the first time in company history, through the first 6 months of this year, we are a profitable insurance company. One more time, through the first 6 months, for the first time in company history, we are a profitable insurance business. Now, why am I bringing that up? As you know, we've had some disruption in the ACA with carriers exiting markets, carriers closing shops. So for us, it's very important that this year we show that we can get the basics right. We can be a profitable insurance business, which then leverages us into 2024, where we want to show total company profitability that's combining the insurance business and the tech side of the house. So exciting things going on here at Oscar. Here's a look at our footprint across the entire country. We are in 19 different states, almost 600 counties, 3 different product lines, and north of 2,700 employees. As I mentioned earlier, I am Phoenix-based. Our operations office is here in Tempe, Arizona. We've all basically been work from home since March of 2020. However, a couple of weeks ago, we announced that we are returning to office here in Tempe, Arizona. I'm very excited. I get to work with my colleagues again. We get to build that team camaraderie again. And I think it just provides not only a better experience internally as an Oscar employee, but a better experience for the members we cover. So here at Oscar, we found that when members engage with us, we can help them realize cost savings. We make it easy for members to navigate their health care, which in turn has driven record levels of member engagement and ultimately led to lower out-of-pocket costs and, most importantly, better health outcomes. Listen, we don't just want to be one of those insurance carriers that hands you an ID card with a phone number on the back and says, call us. No, we want our members proactively to call us, interact with us through our app, which I'll elaborate on a little bit later on. Again, engage with us. We help you realize cost savings. We get you to better health outcomes. Now, let's move on to what I like to call the meat and potatoes of our presentation, which is our 2024 product portfolio. Let's start with a few updates. As you may have heard, or maybe you haven't heard, CMS is limiting the amount of plans that all insurance carriers can offer in 2024. So what that will look like in practice is at each metallic level, there will be one standard plan and up to a maximum of 4 non-standard plan in states that are FFM regulated. Any states that do have a state-based exchange, the plans will look a little bit different there. But again, most states are FFM markets. I'm saying an extra F in there, my apologies. So just look for more condensed plan portfolios, again, not just from Oscar, but all insurance carriers. I think that's a net positive. Less plans to remember, less plans to have to discuss with your clients, and really a more streamlined process. Another piece of exciting news, which I'll talk about a little bit more on here soon, but we are expanding our service area, which is comprised of about 120 new counties. That service area expansion will be found in Ohio, Virginia, Florida, North Carolina, Tennessee, Georgia, Texas, Oklahoma, Iowa, Arizona, Kansas, Missouri, and Illinois. Say that 5 times fast. I dare you. So what's very exciting about this is at this time last year, we were very much about renewing our existing book of business here at Oscar. We didn't really have any expansion plans. It was very much a stay in, the areas that we're in, be successful type of year, which is 2023. 2024, we're again turning on the growth, and we're very excited about what that will bring. If you are familiar with our product portfolio, and more specifically our plans over the course of the last year or two, you know that in select markets, we've launched plans like our Silver Simple Diabetes plan, specifically tailoring the benefits on plans for folks managing chronic conditions. We're doing that again. This is how we refactor healthcare here at Oscar Health. We're launching the Silver Simple Breathe Easy plan in select markets. Again, targeting folks that are managing a chronic condition like COPD. So be on the lookout for that. Those plans are debuting for the first time in 2024. And then there will be some changes to our X deductibles on select elite plans. Silver and gold elite plans will now have a 200 RX deductible. I'll expand on that in just a moment. Who we work with globally across the entire country here. So CVS Caremark is our exclusive pharmacy vendor. We do have other benefit partners listed on the screen here. The only other one that I do want to call out, because I think it's important as it is a commonly used benefit, is that we work with both Quest and LabCorp for lab benefits. Good to know. Some of the markets and highlights or networks that I'll be highlighting today comprise of really 5 markets, although Kansas City, Kansas and Missouri is 2 different states. So it's really 6 states. These are the markets that as a company we're most bullish on. We expect to grow the most in these markets, and we also believe that we have a right to win. So without further ado, let's go ahead and begin with Florida. It is one of the markets where we do have some service area expansion. The new county in 2024 will be Polk County. This is what our footprint will look like in 2024. So all of the counties are listed there. And then in terms of who we work with, we do have a statewide network in Florida, so folks can take advantage of that. And we work with some high quality hospital systems. They're listed on the screen there, just a few to call out: Jackson Health, University of Miami, Advent Health, Holy Cross, HCA, Tenet. So really a strong network statewide. If you do want to look at hospitals on a county basis, that can actually be found on our website, hioscar.com/Florida. brokers. Let's keep moving on here. Another market we're very bullish on for 2024 and also have service area expansion is Georgia. Georgia, we're working with some high quality partners like Northside, Emory, and Wellstar. So the graphic on the screen that you see now, the blue shaded counties are our existing service area, and then the green shaded counties will be our service area expansion for 2024. So I think looking at all of our service areas across the country, Georgia is probably the one that we're most bullish on as a company, where we expect to have a ton of growth in 2024. We are expecting to have price leadership at the silver level in Georgia. Moving forward, this is a market that I'm actually personally responsible for. Very excited about this market as well, which is the state of Texas. Again, similar situation here. Blue shaded counties, our existing service area. Green shaded counties, our service area expansion. Just to give you a high level overview, in today's world, we're in pretty much all of the major metros. So that would be El Paso, Dallas-Fort Worth, Houston, Austin, San Antonio. The green shaded area for our service expansion in 2024, they're a little bit more rural counties. So we are looking to break into, for example, counties that are surrounding our metros. And then really the area with the most population that we're entering in 2024 would be the Rio Grande Valley, which is Cameron County, more specifically Brownsville. So very excited about this market, as it's a market that I'm responsible for. Another one that I'm responsible for, another one we're very bullish on for 2024 is Iowa. So same sort of deal here. Blue shaded counties, our existing service area. Green shaded counties, new service area for 2024. So in today's world, we're in 25 counties. In tomorrow's world, tomorrow being 2024, we're in 50 new counties. There we have a strong partnership with Mercy One, who is our network partner. So if you do have any clients that you assist in Iowa, when you see our plans there next year, we're actually going to co-brand them with Mercy One. So plan names will look something like Oscar plus Mercy One Bronze Elite, for example. So another market that I'm personally responsible for and also excited for next year. Very last one to talk about is Missouri, and we are missing the Kansas state graphic, but we are expanding into Topeka, Kansas, but we are expanding into 14 new counties within Kansas and Missouri. So again, blue counties is where we are in today's world, green counties where we will be next year. And then out of all the central markets, besides Texas, just because Texas has a large footprint, Kansas City, to me, is the one that I'm most excited about in 2024. We will be the lowest cost silver plan in Kansas City, both on the Kansas side and the Missouri side. And our network is large and robust in Kansas City. So we work with KU, North Kansas City, Advent Health, HCA, University Health, that's Lakewood and Truman there, and the Olathe Health System. If you are familiar with the Kansas City area, that means that we work with pretty much all of the systems there, the major ones, except St. Luke's and then Children's Mercy. So we really want to be the best value, best bang for your buck here in Kansas City, being the silver price leader with access to top systems and many providers and specialists. Let's jump on to plan and benefit spotlights for next year. So this plan here, not just our most popular plan in a specific market, not just our most popular plan in a specific state, but really when you look at Oscar globally, this is our most popular plan across the entire country. As a matter of fact, we are seeing other carriers in other markets adopt a plan similar to this. It's the Bronze Elite PCP Saver Plus. The reason this plan is popular is it has a $0 medical deductible from the very first day of coverage. There is an RX deductible of $6,500. I'll elaborate more on that in just a second. PCP copays, $40, specialist copays, $125, urgent care, $75. And then generic medications, you do not have to reach that RX deductible. So generic medications are available at a $3 copay from the very first day of coverage. Now, why do people like this plan? Well, people want copay-based plans with upfront, transparent pricing. So that's what we're delivering to the market. Again, anyone that isn't really managing a chronic condition or doesn't have any specialized RX needs, this is definitely a plan to consider for them. Again, upfront, transparent medical costs. And the other thing to call out here, this plan should be a $0. So not only will it be a $0 medical deductible, but it should be a $0 monthly premium plan for certain FPLs in certain markets. So anyone that maybe doesn't qualify for CSR subsidies on silver level plans, but still wants a plan with a low deductible and also a low monthly premium, this is definitely a plan for them to consider. Now, for folks that are heavily subsidized and do qualify for those CSR benefits, this is the plan that we anticipate to be popular in markets where we have either silver price leadership or will be just in general low-cost silver. It is the Silver Simple PCP Saver. Now, I'm showing you the baseline benefits here. Obviously, if someone qualifies for CSR subsidies, the deductible, out-of-pocket max, and copays are lowered. But here you have a deductible of $5,500, out-of-pocket max $8,900, PCP at $20, specialist $80, urgent care $75, and generic medications, again, $3 from the first day of coverage. Now, all of the benefits I'm showing you on the screen, those copays, $20, $80, $75, and $3, those are day one copays, even though this plan does have a deductible. So we're very excited about this plan in markets where, again, we will either be the low-cost silver plan or we will just be a general low-cost silver option to consider. Again, copay on labs, copay on RX, low PCP, urgent care copay. Again, one more time, any markets where we are low-cost silver or just in the game in terms of silver pricing. So that will be your Georgias of the world, your Iowas of the world, your Kansas Cities of the world. Definitely an option for clients to consider. Let's move on to some of the free perks benefits you get for being an Oscar member. So let's start with the Oscar account creation and why it matters. Well, again, if you remember early on in the presentation, I talked about how when members engage with us, they are able to not only save money, but hopefully get led to better health outcomes. That all starts with creating an Oscar account upon enrollment. That Oscar account will allow for members to pay for monthly premiums, search for in-network care, review plan details, send secure messages to their care team. So maybe you have a client that, like many of us at this time of the year, works a busy 9 to 5, or maybe it's a 6 to 6, whatever the case might be. They can't jump on the phone with their care team. Well, they can securely message their care team at their convenience through the Oscar app. They can also review and renew active prescriptions, access to cost estimator. So maybe they are seeking care in our network and they want to get an estimate as to what that care will cost. And then also virtual urgent care, which is our version of, virtual services. So while other carriers offer a third-party service like a teledoc or something else, we offer something in-house that's proprietary called virtual urgent care, which on most plans is a $0 benefit from the very first day of coverage. Again, what makes ours unique is two things. One, this service is something that has been offered at Oscar Health since its inception back in 2014. So I know that telehealth, virtual services became a trendy topic during the pandemic a few years ago. This is something we've been doing since day one, 10 years ago. And the second thing, again, that makes it differentiated is that it's an in-house proprietary service. So the doctors that your clients would speak with are actual Oscar in-network doctors. It's not a third-party service. This is what home base looks like within a member's account. Very nice, easy to use interface. So, some arrows here pointing out the features. Again, send secure messages to the care teams, renew prescription and request virtual urgent care, search for in-network doctors and places. They will also have access to digital ID cards, coverage details, claims, and paying their monthly premium. So wonderful interface. I really love our engineering and tech team. They make our life so much easier, and hopefully your clients, our members' lives that much easier. Let's move on to pharmacy. Our pharmacy is our formulary pharmacy benefits are fairly standardized. The only part that does have some nuance is tier 1, which I will talk about in the next slide. But everything else fairly standardized. Again, if one of your clients takes a medication that's not in our formulary, they can seek a non-formulary exception, which that process is fairly standardized across the industry. And then 2 other things, prior auth step therapy, another process that's fairly standardized. But it's a 4-tier formulary. So tier 1, mostly generics, tier 2, preferred brand, tier 3, non-preferred brand, and then tier 4, specialty medications. Let's talk about that nuanced tier 1A, and we also have a tier 1B. So tier 1A would be our preferred generic medications. Tier 1B would be non-preferred generic medications. Here at Oscar, we have this tier 1A list. So we've actually identified that 82% of our members are prescribed or could switch to a tier 1A medication. It includes 97 drugs with 298 different variations, including some branded insulins. This $3 copay benefit, again, is not subject to the deductible on most plans, and listed drugs on this tier 1A list will cost members $3 or less from the very first day of coverage. Again, just to summarize here, it's a benefit that's featured on all individual and family plans except catastrophic or HSA plans. Unfortunately, regulators don't allow us to circumvent and offer this benefit on those specific types of plans. So tier 1A, again, $3 or less, those are preferred generic medications. And again, that includes 97 different medications, almost 300 different variations. We're very excited to offer our members this benefit, as it's another way that we try to save them a little bit of money. Let's move on to our broker support team. This is a wonderful team that, again, is located in our Tempe, Arizona office, which, again, I talked about earlier. We are returning to office. So I will get to interact with these folks when I drop into the office as well. But their contact information is listed on the screen here, 855-672-2713. They can also be reached via email, brokers@hioscar.com. They are 8 to 8 Eastern, Monday through Friday. And if you're Central, that would be 7 to 7. Then if you're West Coast like me, again, I'm in Phoenix, Arizona, I believe that would be 5 to 5 if I've got my time correct. I feel like the time changes at some point. I do want to say maybe it's in November. So I think during the time change, maybe the West moves from 5 to 5 to 6 to 6. It's all one. It feels like when the time changes, open enrollment begins, and it's just one giant kerfuffle, if you will. So just know they're there to assist you with anything you might need. Now, this is another thing we're very excited about, which is hioscar.com/brokers. This is where you would get all of the resources you need in order to sell an Oscar plan. So this page will have plan documents, marketing materials, also you can see the provider search. So let's say you have a client that comes to you and says, hey, is this hospital in network with Oscar? Is this doctor in network with Oscar? You can use that provider search tool, which is very easy to use. And then you can also register for any upcoming events we might have. So maybe you want a deeper dive into what our Florida market looks like, our Georgia market looks like, our Texas market looks like. You can do that if you'd like at your convenience. And with that being said, I do want to wrap up today. Again, I am filling in from my colleague Jared, who is out. Me and him have both talked ahead of doing presentations and webinars. Normally, we like to block out an hour in the calendar, but we know this is the busy time of the year. And my thing is, if I can't tell you why Oscar will be successful in 20 to 30 minutes, how can I expect you to go then tell your clients why Oscar would be an option in less than 20 or 30 minutes? So Jared's contact information is listed here. I do want to open it up to some Q&A, Nick, if any came in. And just, again, thank you for having me and giving me 20 to 30 minutes out of your busy day.
Oh, no, Sebastian, this was great, man. Seriously, this was awesome. Thank you so much. And yeah, I've worked with Jared a lot before. Love that man too. Guys, this is the time. If you have questions, throw them in while we got Sebastian here with us. There was one, but I'm not sure if you answered or not. Just said, how competitive are you guys in Michigan, if you know off the top of your head, or is Michigan a market that you guys are particularly competitive in?
Yeah, great question. I am very much a transparent, upfront person. We are in Michigan. We just are not very competitive, not only in today's world, but most likely for 2024. So while I'd love to tell you to, hey, go sell Oscar in Michigan, we just won't probably be the most competitive carrier in 2024. So that's the answer to that.
No, I love that, man. Honestly, a lot of these agents appreciate the transparency. Tell us where we're going to sell you, why we're going to sell you. And hey, now we know. We get this situation. We know where we're going. And I think you did a great job at that. So thank you very much for that, Sebastian. Guys, we'll give another minute or two if more questions come on in here. I'll take the screen back for you too here, just so I'll throw up our closing screen here if we need. But guys, this is the time if you have any questions. Is that because of price or benefits? Generally, price is one of the main factors on where you'd say we wouldn't be that competitive, but I'll let you answer that, Sebastian.
Yeah, I'd say when you look at Oscar globally across the country, I think our benefits are fairly competitive. When I say that we most likely won't be competitive in a market, it's usually one of two things or a combination of both. It's the fact that our pricing is probably not in the game, or it's that our network, relatively speaking to other competitors, is not really where it should be to give us a right to win. I think in Michigan's case, it's a combination of both. There are certain markets where, we land the pricing, but maybe the network isn't competitive, but anyone that's price sensitive may still consider Oscar, or vice versa, right? Maybe the pricing isn't in the game, but we have, sort of a Cadillac network in a market and people want that. But yeah, Michigan's just one of those situations where we don't really have the pricing or the network.
Yeah. Yeah, it looks like, you were hitting hard on Florida and Georgia, so it looks like the South is going to be a good area for these Oscar plans this year. And then for the rest of the people attending for the market, this is just normal stuff with carriers though, right? We're always picking and choosing some markets we want to focus on this year and develop our business in, right? And so Oscar kind of gave you the keys on that right now, right? Sebastian gave you the keys on where they're looking at going, where they're really building up their market base right now. And so it's always, you can't ever pick all 50 states as a carrier, right? So you have to pick a few and drive those home. And so not to say they won't be competitive in Michigan in years to come, but not the immediate future, right?
Correct.
Cool. Well, it looks like that's all the questions that came through. Sebastian, we appreciate the heck out of you and coming in and giving us some time here on your busy Thursday. We know this is busy time of year, so really, really appreciate that.